October is Breast Cancer Awareness Month, which is an annual campaign to increase awareness of the disease. The past year has posed a huge challenge to just about everything, and breast cancer prevention is no exception. According to the National Breast Cancer Foundation, the coronavirus pandemic has caused setbacks in screenings and early detection. To help us unpack the fight against breast cancer during the COVID-19, we're now joined by Professor Michael Herbst, clinical health specialist at the Cancer Association of South Africa. Professor, very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Thank you very much for having me on your program.
Well, to what extent has the past year during coronavirus pandemic affected the fight against breast cancer?
Yes, I can tell you that the impact was quite severe because, so many people are dependent on the public health system. And the public health system was under a lot of pressure ever since the commencement of the COVID-19 pandemic. And this resulted in people not being able to access health care that they were really entitled to, not because of a lack of willingness or preparedness, but because of an overburdened and overtaxed health system.
So do you get a sense then that the attention has now been diverted from awareness campaigns of breast cancer into COVID-19?
Well, I'll tell you, from the Cancer Association of South Africa's side, we are still doing everything we possibly can to spread the message of the importance of breast health and of people really taking care of their breasts, doing breast examinations, still going for their mammography, and really having clinical breast examinations done whenever they have the opportunity to do. But of greater concern is that information tells us that very few people in the public are really aware of the fact that not only women get breast cancer, but men as well. And for every 100 women diagnosed with breast cancer, at least 3 men are also diagnosed with breast cancer.
I'm actually glad you touched on the topic of diagnosis of breast cancer in men. And in terms of the awareness, what's your analysis or understanding of how well men are clued up in terms of breast cancer in them?
Well, men are really problematic as far as health-seeking behavior is concerned.
Yeah.
We believe that we are the hunters, we are the strong ones. Cowboys don't cry, all these other sayings and things. But men are really bad to go to a doctor whenever there is something wrong in their body. And that's why, when I talk men's health, I prefer to talk to the women, because they are the ones that I convince to say, take responsibility for the man in your life, whether it is your husband, your life partner, your brother, your nephew, your father, your uncle, your grandfather. Nag them if you are aware that there's something wrong with them, and nag until you've got them into the doctor's consulting room.
Let's talk about affordability of mammography services in women especially, because we know that these come at a huge cost, and some of the women do not necessarily have access to medical care such as private health care. So how do we navigate around this particular subject?
Yes, this is a concern of mine as well, and that is the people who are dependent on the public health system. And here we're talking 80+% of the population. They really have a problem in getting access, and especially so whenever we move up in the tables as far as lockdown is concerned. Like when at level 3, there's really very, very problematic for them to get access. People with health insurance, on the other hand, they are the fortunate ones, and they can continue to have, because they've got the funding coming from their medical aid. And the problem is that really people in the far rural areas, they are even worse off than people still in urban areas who are dependent on public health service.
And there's been concerns about some breast cancer treatments such as chemotherapy and immunotherapy can actually weaken the immune system and possibly cause lung problems. Your thoughts?
Well, I'm very thrilled that you are mentioning the fact that, it's not only the treatment, that can affect the immune system of the body. Even a diagnosis of cancer, we know that the disease cancer itself affects the immune system. And this is why it is so important that people who are diagnosed with cancer or who are currently receiving cancer treatment should really go all out to have their COVID-19 vaccinations up to date, because these are the people with a lowered immune system who tend to land in hospital, who land in ICU, who land on respirators. So, and I was so thrilled the other evening when Dr. Paasla, the Minister of Health, announced that people with an affected immune system should really now go and get a booster dose of COVID-19 vaccine. It is so important, really. An early diagnosis, then to get back to breast cancer itself, an early diagnosis is so important because early diagnosis leads to early treatment, and early treatment really leads to the possibility of going into remission.
But can people with breast cancer get a COVID-19 vaccine? And if so, at what stage of the breast cancer will they be able to do that?
Any stage. The sooner they get it done, the better. There is no scientific evidence telling us that there's any possible harm, any different possible harm to an average person on the street or somebody who has been diagnosed or is receiving cancer treatment.
So just do share with us, Prof, what is it that people who have been diagnosed or have this particular breast cancer need to know at this particular moment as we live in the era of COVID-19?
Well, I think the important thing is to know that we have to be aware of our breasts. And here I'm talking to all women, and we see more and more younger women in their 30s and early 40s also now being diagnosed with breast cancer, where a few years back it used to be a disease of more older women in their 50s and older, and more younger people. And again, when we talk men, as far as breast cancer is concerned, percentage-wise, more men die of breast cancer than women. And it just makes it such a complex disease, and it makes it difficult if people, especially men, if they don't go for an early diagnosis. And that is the problem, that when men really wake up and go to the doctor, very often the breast cancer is advanced. Because we must remember that the breast tissue in the male is much less than in the female. So breast cancer in the little breast tissue that is available in the male breast, the cancer spreads very, very quickly. And from there, it metastasizes or spreads to other parts of the body. And this complicates treatment, and it can increase the cost. You've also made mention of immunotherapy.
Yes.
Yes, this is one of the latest forms of treatment of various cancers. But unfortunately, immunotherapy is only available to those who really have the financial means to pay for it. Because on average, many of the immunotherapy drugs are very, very expensive and can cost up to R1 million per person per year.
So if I've got breast cancer or I've had it in the past, what's the possibility of me suffering from severe illness of COVID-19?
An early diagnosis, early treatment, and there should be no unnecessary complications. But really, the message to everybody is, anything that is different in your body today than it was last week or last month or last year, please have it seen to, so that we can get an early diagnosis, early treatment, and your chances of going to remission are very, very excellent.
Okay, Professor Herbst, great chatting to you. Thank you so much for joining us. All right, thank you. That was Professor Herbst from the Cancer Association of South Africa. Well, this is The Globe on SABC News. Let's take a quick break.